Hi, I'm Andrea Stevens. I'm a clinical nutritionist, and I'd like to talk about pregnancy today, or even more importantly, pregnancy planning. The state of health of the mother is really important to the state of health of the baby. State of health of the father is also important. It is. It used to be thought that it wasn't that important, but recent studies have shown that the sperm of the man and the health of the sperm nutritionally is important to the development of the baby. But still, most attention goes on the mom. So the mom really needs to start planning, ideally should start planning for pregnancy at least a year ahead of time, If she has any kind of diagnosable health conditions, she really needs to try to get that under control in as natural a means as possible. If she must take medication, be sure to know what nutrient deficiencies might develop as a result of that medication, because that is the reality. Most medications will result in some nutrient deficiencies of the body, so she needs to supplement with additional nutrients to make up for that medication that she's taken. But even if she's not taking any medication, there's 2 or 3 supplements that I think she should be taking. A prenatal vitamin. Prenatal, before she gets pregnant. That's what prenatal means. Pre is before, well, before birth. Should be before conception. It should be a preconception vitamin to make sure that she has all the vitamins and the minerals in her body before she even conceives. Also, omega-3 fatty acids, fish oil or krill oil would be really great, because in that first trimester, the first 3 months of pregnancy, that's when the brain is developing and the nervous system is developing, and the omega-3 fatty acids are really important for that, as are some of the vitamins and the minerals in that multivitamin and mineral. They're really important in that first trimester. So you need to really be taking it before you conceive, if you can. The third supplement I think that would be really helpful would be a probiotic. A probiotic are the good bacteria that are present in large numbers in the intestines, but also in the vagina or the birth canal. And when the baby is delivered and is coming through the vagina, through the birth canal, the baby will pick up the first of the good, healthy bacteria. And if the mom's got good, healthy bacteria, the baby gets them. And you really want to try to provide that for your baby. So those are the supplements. Of course, a natural whole foods diet, organic as much as possible, wide diversity of vegetables and plants and good oils. Don't avoid the good fats and the good oils. Really keep your processed foods down to a low amount. Fast food restaurants, non-existent or very, very minimal. Lots of water, drink lots of water. So that natural whole foods diet is very important, with lots of filtered water, pure water please. But also the environment. This is the last issue that I want to touch on, is look at your personal care products, your cleaning products, your laundry products, and get as natural as you can with all of those things. Everything you put on your skin gets absorbed. It gets into your bloodstream. And once it gets into your bloodstream, if you have a baby starting to grow inside of you, it's getting to the baby. Don't use perfume. Don't use fragrances. You're just delivering those chemicals right to your baby. So clean up your environment, clean up your personal care products. A great website for resources is skindeep.org. Skindeep.org, that's part of the Environmental Working Group, or EWG.org. That's another great reference site. You can get some good recommendations there for the kinds of skincare products and makeup that you might want to use. Laundry detergent, fragrance-free, no artificial colors, no artificial dyes. Fabric softeners generally are not a good idea. Don't use fabric softeners. Just use less detergent and do a second rinse, and your clothes will probably be pretty good. And your cleaning supplies and your cleaning products. Go as natural as you can in that area. And that's it. Be as natural as you can with your food and with your environment. Thank you.